I guess having done the intro for me, I can kind of skip over the first thing because I only have 5 minutes, so I had a 20-second bio here. But I grew up in fitness. My education's in economics and philosophy. I played pro football, and then I worked as a trainer and ran gyms and clinics, and also did the operations for a chain of gyms and clinics. So everything from paper and pen, actually trying to different ways of selling fitness, engaging fitness, and is mostly based around the corporate wellness sphere here in downtown Toronto. Before I got into the tech world. So today I want to talk a little bit about bridging the gap between fitness and healthcare, right? And how that happens. So the problem, as we see it, is with fitness as the top form of preventative healthcare and treatment in many cases, the fitness plan and the fitness professional still exist outside of the circle of care. Even though more money right now is being spent on fitness, and more fitness apps are coming out, all the time these days, we're still not seeing a big noticeable effect on health outcomes. So this presentation is going to focus a little bit on why this gap exists and how technology can be used to basically start to help close it, right? So why does this exist? Well, if you think about the fitness industry, and I was talking to somebody just a few minutes ago and they brought up like 3 or 4 of these points right away, right? Well, fitness professionals are a real low bar of entry, right, to become a fitness professional. Some people don't even have any education. They just call themselves a trainer, and people start paying them to give them fitness advice because they've looked a lot on YouTube, right? That's true of the second point, that there's a range of education and experiences, right? You can do a weekend course and become a certified personal trainer, or you can do a whole master's degree and be a trainer, and there's no real way of knowing what that range of experience and education is. There's no college like in extended healthcare for physiotherapy, chiropractic, all that. So there's no bar that's set, that's a trusted bar, right, in the fitness world. Sales tactics also play into this. Oh, this slide kind of ended up weird. There's another thing at the bottom. Sales tactics, right? The fitness industry is well known for its sales tactics, which also damage the credibility of the people that are working within that industry. And the reality is people get into personal training because they're caregivers by nature, right? That's why they want to help people out, and the industry and all the tactics that come around it kind of, totally miss that message. So the consequences of this, right? The consequences are there's super, super low engagement with fitness professionals. So only about 2.4% of the population works with a fitness professional to get their plan advised, right? So not over 97% of the population is freewheeling it on their own for fitness, right? For their preventative healthcare plan, essentially, right? The reason being is it remains too expensive, for most people to pay for on their own. Yet the cost of prevention on businesses and on healthcare, for not doing prevention, the cost for treatment and the consequences of it are very, very expensive, right? So again, as we said earlier, more money being spent, more apps than ever, yet no dramatic improvements, right? And also the nature of the business is turning these fitness professionals into salespeople as opposed to caregivers. It's changing the game. So how do we get there, right? Well, there's a sort of traditional ways of thinking about it, right? Which is, everything from a certification, and again, there's a range of certifications. Not everyone has the same certification. Not every fitness professional is going to have that. Not sure that's an effective way of really bringing this person or getting that measure of efficacy. The college, there's already been a big, the kinesiologists have been fighting to get kinesiology covered by extended healthcare benefits and by things like OHIP. But again, that's taken a long time, and it's still a long time away from being, really there. And especially since, for any physiotherapists in the room, may be concerned about the kinesiologists sneaking in on the physiotherapist territory, as opposed to being in that group, that place for preventative healthcare. There's also people that are embedding trainers more and more in places, whether it be within businesses, within hospitals, doctors' offices, but again, not very effective. On the right side, you've got all the data-driven approaches, right, to making fitness more relevant, and really this is where I think the path to making fitness a relevant part of the healthcare conversation comes from, right? So you've got the fitness tracking apps that are more consumer-facing. Again, there's no one on the other end of it who's a professional. This is somebody kind of freewheeling it, or an algorithm is, spitting out the program for you. The second thing, wearables that track a lot of metadata, but with very little context. So there's some health indicators go around it, but the context is kind of missing. And then there's the bottom there, which is tools for gyms and trainers, which is where I've kind of banked my money, which this is where I'm making my bet, right? That it's in empowering the gyms and trainers to be more accessible, more affordable. In other words, for them to be giving and prescribing the plans and working that way, right? So, just flip my notes here. So, the data we capture on those realms means very nothing without the context and long-term accountability in the realm of healthcare. And capturing it effectively and then sharing it with the various stakeholders within that circle of care is really the key to getting there, right? The key is to making the professional and the plan a part of the whole healthcare conversation. So In other words, a doctor doesn't need to know how much somebody bench presses, right? They need to know how often the person has been in the gym lately, what changes may have been made to their body composition that actually affect positive health outcomes, right? And they also need to know that the trainer they're recommending is actually effective at getting the goals they need to get to, right? And that they can trust that they're going to be effective at what they do for their patients. So for the patient, it's also about knowing that there are other layers of accountability within the circle of care for their fitness or for their preventative plan. So that provides additional extrinsic motivation for them. And while a fitness professional is what will provide the sort of personalization and customization and support they need to actually reach their goals. So this approach, looking at it that way, is sort of democratizing the treatment, which is another trend in the healthcare sphere, right? So for the fitness professional to focus on what they really do well and what should be best for that preventative plan, and for the doctor and other specialists to do what they do well and only intercede here where they need to be, right? So what does that look like, the future of it, of an integrated preventative healthcare? It means the fitness plan itself or the fitness record is a part of the overall health record, right? It's coordination between the trainers and the rest of the circle of care. It's objective measures of efficacy, right? So data is what's going to drive these measures of efficacy in the long term, not in the short term. In the long term, we need those data points first before we can start to measure the efficacy of a fitness plan and a fitness professional, right? A long-term goal that should be here. Patient empowerment, so more layers of accountability around that patient and that empowerment to make extrinsic motivation turn to intrinsic motivation over time. And that personal training becomes something that's covered or subsidized by extended healthcare benefits and by the healthcare system in general. Right? So in other words, a vision where a world where everybody has access to an effective preventative healthcare plan that's actually advised by a fitness professional. Thanks very much. Okay, any questions? I talked really fast.
So the last point you have there is personal training covered by the healthcare industry.
Yep.
How do you get over the mindset where traditionally they measure ROIs by getting someone healthy, not preventing? So what you're trying to help someone is to prevent them from having a problem. So how do you get over that point?
So in the corporate wellness world, I think the biggest measurements of ROI that people are looking for the money they spend on corporate wellness is how does it reduce things like their pharmaceutical bill for overall, right? How does it reduce sick days? How does it increase productivity? So there's direct measures between, obviously if people are focusing on being fit, being active, having these things, and how that relates, to that ROI on the corporate wellness side of things. So I think that's the tightest correlator there. Is that what you meant? Yeah. Yeah, okay. Trainer Plus? Yeah, it's a web and mobile platform. So we sell directly to gyms and trainers, and we give them a tool that makes it really easy for them to track everything from the moment they first meet someone coming in the door, for every assessment and follow-up and their whole workout plan, all the relevant data around that. So we are aiming to be the world's first electronic fitness record, or EFR. So extending what used to be the EMR down to now the EHR is the thing that's been a big buzzword the last couple of years. The electronic health record, which includes extended healthcare benefits. So we'd like to see that extended one more layer further into the electronic fitness record. So it's right from preventative healthcare all the way through. Yeah. Yep.
So you're selling to gyms and personal trainers.
Yep.
You also talked about corporate wellness.
Yep.
So why sell to them and not to the corporate organizations or even insurance companies?
So, great question. I'd love to sell to insurance companies and convince them that this is the future that a subsidized personal trainer is much, much, much a better ROI than a subsidized gym membership that may or may not get used, right? So I'd love to sell there. They're very reticent to see it, quite frankly. And for me as a path to market, if I go to a gym and I say, hey, imagine if you used my platform like this. And we have an example of it. We actually have in the incubator that we have a program called the Trainer in Residence. So every company, every employee within the building has a personal trainer provided by Ryerson University, who's one of our first customers who licenses our platform. So every employee has a free consult from a trainer. They can get it on a monthly basis and have that follow-up. So it's something really valued by the incubator. And for the trainers who are in there, the reason they're doing it and volunteering their time is because it's a great lead generating source for them. They have this very honest conversation about them, and if they need help above and beyond that, Then they have Trainer Plus that gives them new options for fitness support. So some just need a fitness program that they get from the trainer at Ryerson, but that they execute at the Good Life in the Basement, and sort of everything in between. So that's just sort of one example of how our platform can be used by a fitness organization to actually drive the business. So by giving them the tool and then giving them ideas like, hey, this trainer resident thing is really cool. Imagine if you went and sold this to the 5 businesses around you, they go and sell for us. So our incentives are aligned very well with the gyms and trainers to go drive their business to end users. We just give them the tool and the ideas on how they could sell it. Yeah.
So one of the important factors in health is diet. Are you capturing that?
No, not yet. I actually used to work at a startup that did meal planning. It's very, very complicated, a degree more complicated than this. And I can say I've not seen anybody doing it very well yet. So what our trainers have asked us for is there a way they can communicate that nutrition stuff? Rather than building a really complicated tool about it, we're literally adding a feature where they can attach a document specific to somebody. And for most trainers, that does, because they've got either a general idea or just a general meal plan or a PDF or a document that they'll just attach and send instead of sort of creating a whole nutrition and meal planning tool. But we are experimenting a little bit with that. There's some very basic parameters like just macros or something that they can prescribe. At the end of the day, personal trainers aren't really supposed to prescribe nutrition. They're supposed to give guidance, but not prescriptions. So that's where we want to be very careful about how we wade into that.
But since you're going up collecting data, they can just collect that data and then communicate that.
I'd love it. I would love to have all the data on what's going output to go along with all the data that's coming in. And that would give us that billion-dollar equation about how bodies really work, right? We need billions and billions of data points about calories in, and we're hoping to capture the billions of data points on calories out. So maybe it's something we evolve in the future. I'm hoping somebody comes along much, much before that does it really, really well and we can work with. Yeah. This is already pretty complicated to solve, the behavior between a trainer and their client. So that's a whole other layer of behavior. I think I should boot.
You mentioned in one of your first slides that one of the pains in the industry is the wide range of accreditation, right? Is this aiming to solve that by standardizing some of the...
It's kind of the opposite, is that by us being actually able to capture all these data points about people's progress related to the workouts they're actually doing, over time we'll be able to get more predictive algorithms around efficacy, around the efficacy of a certain exercise or a certain plan or a combination of exercises or a trainer relative to the goal that's set. So that I believe is the pathway there. Yeah. Great. Awesome. I'll turn it back over to Maggie. Thank you very much. Thanks.